I received a comment on my ectopic pregnancy video. This viewer had a few questions, and I'm sure she's not the only one asking. And so I decided to make a video to address her questions. She says, I had an ectopic pregnancy on my left fallopian tube, which was removed. She then says, I want to understand what role my left ovary plays now. Can it still contribute to the next pregnancy, or only the right side is in play? And what can I do to increase my chances of a healthy pregnancy? Hormones, natural remedies, food, and exercise. These questions are so important for women who have suffered an ectopic pregnancy. And the answers, especially the one about the left ovary or the ovary from which the fallopian tube has been removed, will surprise you. Stay with me, because I believe that this video will change what you believe is possible for you if you've had an ectopic pregnancy. Hey, welcome to Hey Doc with me, Dr. Kady. I am board certified family clinician. Here on Hey Doc, we discuss women's health, reproductive medicine, and antenatal care. If that's your thing, consider subscribing, liking, and sharing. Also, I'm the author of Waiting on God His Way and Position Yourself for Results. Check out my book, it is available on Amazon. Before I go into talking about the clinical stuff, I just want to acknowledge something that is real for a lot of women who have suffered an ectopic pregnancy. Losing a fallopian tube is a loss. It's a loss of a pregnancy, a physical change that happens to your body. And often what accompanies this change is the fear of what will happen next. And you are absolutely allowed to feel that way. But here's the thing, I want to reassure you that many women have gone on to have successful pregnancies after losing a fallopian tube to an ectopic pregnancy. Let me show you exactly how that is possible, starting with the ovary question. One of the things that can happen when a woman goes through an ectopic pregnancy is the feeling and the sentiment of, oh my goodness, she is the only one that this has ever happened to. She thinks of all the things that she could have done wrong, and she often feels guilty. So if you're watching this video and you've suffered from an ectopic pregnancy before, I'd like you to drop an up finger emoji so that another woman knows that yes, she's gone through an ectopic pregnancy, but she's not alone. Other women have experienced it, and many of them have come through okay. But I also want to understand how many women in this community are walking through the same road. Let's talk about the anatomy that everyone gets wrong. The fallopian tube and the ovary on the same side are not directly linked. They are not connected. Now, I'm going to say that again because that changes everything. Your ovary and your fallopian tube are two separate structures. They sit near one another, but the ovary is not directly attached to the fallopian tube. At the end of each fallopian tube are finger-like projections known as fimbriae. When you ovulate, your ovary releases the egg, which these finger-like projections called fimbriae will then sweep into the fallopian tube. The fimbriae catch the egg. They do not receive the egg through some type of connection. So in essence, what I'm saying is there is a tiny gap between the ovary and the tube. Now, this biological basis is the reason why the next parts that I'm going to talk about is possible. When you've had an ectopic pregnancy, your affected tube is removed. Very often, the ovary on that side where the tube was removed is left behind. It still has its nerve, its blood supply, and it contains the follicles still that are still producing the eggs every cycle, because the ovary that is left behind is still responding to the hormone called follicular stimulating hormone, FSH. That ovary that has been left behind still is able to ovulate. Here is the remarkable part though. When that ovary that no longer has a corresponding fallopian tube, the egg does not automatically fall into a void. This is because of a phenomenon called transuterine or transperitoneal migration. It's also sometimes referred to as cross-picking. The other fallopian tube that remains is actually able to pick up the egg that was released by the ovary that no longer has a corresponding fallopian tube. So in the case of our lady on our community that asked about the role of the left ovary that has been left behind, her right fallopian tube is able to sweep through the pelvic space and collect the egg from the opposite ovary. Believe me, this is theoretical fact that has been documented in medical literature. Real stuff. So the answer to my subscriber's question is yes, your ovary that no longer longer has a corresponding fallopian tube absolutely still plays a role in your fertility. Now, let me be honest with you about the numbers, because I believe you deserve accurate information, not just reassurance about the numbers. Having one fallopian tube does reduce your monthly conception probability compared to if you had two fallopian tubes. That's simple mathematics. However, studies have consistently shown that women who have suffered an ectopic pregnancy and have been left with a single healthy fallopian tube have a natural conception rate of 50 to 60% within 18 months of trying, depending on other factors, of course, like age. In fact, there have been observations that women who have had the actual tube removed have a higher rate of falling pregnant again compared to the women who have just had the tube that was affected by the ectopic pregnancy. They've had the tube open up and the fetus that implanted itself in the tube removed whilst leaving that tube behind. The latter procedure is a salpingostomy, whilst the total removal of the tube is a tube, are better off than women who have had the tube that had been affected be left behind, is simply because the damaged tube left in place still poses a risk of another ectopic pregnancy happening within that tube that we have tried to preserve. So in essence, I know it feels like you've lost a part of yourself when your fallopian tube was removed, but think of this: the removal of an affected fallopian tube gives you a clean start, because you should be left with what we are hoping would be a healthy fallopian tube, giving you a cleaner foundation for your next pregnancy. Here's the thing about cross-picking. Remember the biological phenomenon where we say the egg that has been released by the ovary that no longer has a corresponding fallopian tube can be picked up by the fallopian tube on the other side, hoping that that tube is healthy. Researchers have found that this cross-picking contributes to 20 to 30% of conceptions in women with a single fallopian tube. So be reassured that the ovary that has been left behind, that no longer has a corresponding fallopian tube, still is in the game. It is not just a bystander. So I guess the next logical question is, when should the ovary that still has the healthy fallopian tube be ovulating? Okay, the ovaries do not always alternate perfectly when it comes to ovulation. I mean, it's not strictly left, right, then left again, then right. It doesn't work like that. Researchers have shown that ovulation is somehow random between the ovaries from cycle to cycle. And some women's bodies will display a preference for one ovary for several months over the other ovary. Now, what does this mean for you practically? If you are a woman who's on a mission to getting pregnant, you must know which side is ovulating each month. Ovulation happening from the ovary that still has a corresponding fallopian tube gives you the best chance at conception. So whilst the ovary that no longer has a corresponding fallopian tube is not a waste because of the phenomenon of cross-picking that we have explained, but your highest probability months will be the months where you are ovulating from the ovary that has a corresponding healthy fallopian tube. Now, how will you go about tracking which ovary is ovulating? You will need to have a transvaginal ultrasound at the follicular phase of your cycle. That's around day 10 to day 12 of your cycle. And this will tell you which side has a dominant follicle. You can sometimes feel it yourself. You'll feel some type of cramping on one side of your pelvis. That is called Mitchell smirks. That's the mild one-sided twinge that some women feel around the time of ovulation. Ask your doctor or fertility specialist about follicle tracking. So now on to maximizing your chances of a successful pregnancy after having had an ectopic pregnancy. What can you actually do to increase your chances of a healthy pregnancy? The first step to optimize timing. With one fallopian tube, timing intercourse becomes even more important. You have less margin for error and precision actually matters. Your complete timing protocol is listed right here. The first step is to start using an ovulation predictor kit around about day 8 of your cycle. Test daily and test at the same time each day. Let's say between 2 to 4 p.m. would be best. You must know your cervical mucus. Step 2 is to observe your cervical mucus daily. When it becomes clear, stretchy, and like the egg white substance, then you are in your fertility window. Begin to have intercourse regularly. Step 3 is that when your ovulation predictor kit tests positive, make sure that you have sexual intercourse that night and the following day also, because this is your highest probability window. When your predictor kit tests positive, it means that you are going to ovulate within the next 24, maybe 36 hours. But to stay on the safer side, just know that you haven't ovulated necessarily that day, but you are likely to be ovulating within the next 24 hours. So if you have sexual intercourse on the date of testing positive, remember the sperm cells live within the reproductive tract for 5 days. If you have sex that day and then the egg gets released, then the sperms will already be in the fallopian tube waiting for ovulation to happen. And once it's happened, it will be right there to meet the egg without delay. And step 4 is to ask your family doctor to give you a transvaginal ultrasound as a way of follicle tracking. By doing that, you'll know which of the ovaries is going to be producing the egg that will be released during ovulation for that cycle. If it's the right ovary, which is the case for our subscriber that asked this question, her left ovary was removed, but she still has her right ovary. After doing follicle tracking with an ultrasound, say it is found that her dominant follicle is on the right side, she knows that she needs to be prioritizing natural conception and be actively trying, because natural conception is more likely to happen that month because that ovary still has its corresponding fallopian tube. If it's the left ovary, remember, do not lose heart, do not be depressed, do not lose hope, because cross-picking, ladies, is real. Step 2, what should you eat and why? So the subscriber asks about specific foods, and the good news here is that the evidence is clear and practical. Your conception nutritional goals after an ectopic pregnancy are: number 1, to support ovarian function and egg quality, and number 2, to support the health of your remaining tube, and 3, which is very important, to support reduced inflammation within the pelvis, and 4, to be able to have a diet that supports early implantation. You must have folate-rich foods every single day. These include spinach, kale, lentils, avocados, and broccoli. You must start supplements with folic acid. This is critical for cell division as soon as fertilization occurs. Start your supplement today if you haven't already done so, with a minimum of 400 micrograms of folic acid. This is on top of eating folate-rich foods. Having oily fish 2 to 3 times a week. We're talking about salmon, sardines, and mackerel. Omega-3, DHA, and EPA, these reduce the inflammation that happens in the pelvis and supports the hormonal environment that is needed for conception and implantation. Have daily antioxidants-rich food. We're talking about berries, bell peppers, tomatoes, dark chocolate, and green tea. Antioxidants protect and promote good egg quality, as well as reducing inflammation that can be occurring in the pelvic area. And oxidative stress and pelvic inflammation is highest, especially after having just had your fallopian tube removed, so post-surgery. Eat 1 or 2 eggs daily if possible, because eggs contain choline, and choline is critical for early fetal brain development. Have lentils, beans, and chickpeas regularly. These contain iron, protein, and folate all in one. Having iron deficiency after suffering an ectopic pregnancy is very common, and if you get pregnant again without addressing this iron deficiency, it can have a significant impact on your next pregnancy. So you need a good amount of iron, because you need to build up a good hemoglobin store, a good red blood cell store, because you have just lost it after having had the ectopic pregnancy. Get your ferritin levels checked, because that's the form of iron that the body can actually use. Nuts are super important. You want walnuts, you want Brazil nuts, you want pumpkin seeds. A daily handful of these will do you just fine. They contain zinc, selenium, and magnesium, and all of these are important to maintain good egg quality and to help with your hormonal balance. The types of food that you should reduce the intake of are the ultra-processed foods, the refined sugars, the excess alcohol. These drive inflammation and lead to insulin resistance. And both inflammation and insulin resistance can impair ovulation quality. Step 3 is hormonal balance. The subscriber asks about natural remedies. She inquired about teas and supplements to balance her hormones. I want to answer this carefully because not everything that is marketed as a hormone balancer is actually evidenced, but some things are. Let me share what some of these are. Chaste tree berry. This has some evidence for supporting progesterone levels in the luteal phase, and it helps to regulate cycles in women with luteal phase deficiencies. If your cycle has been irregular since having an ectopic pregnancy, ask your doctor about Vintex. Remember, do not just go ahead and take these that I'm talking about. Always inquire with your doctor. I am sharing this information for educational purposes, but I do not know about your personal medical history, not to talk of some allergies that you might have. So take this information as education and information that has come to enlighten you, but always take it back to your doctor and discuss it before you do anything. Remember, do not take Vintex during pregnancy. Next is myo-inositol. If you have a history of PCOS or insulin resistance, as well as just having had an ectopic pregnancy, this has strong evidence for restoring ovulation and improving egg quality. Coenzyme Q10, 400 to 600 milligrams daily. This helps with egg quality specifically. It supports mitochondrial function, which is the energy engine inside each cell. And it's particularly helpful if you are over the age of 35 and you're trying to conceive, or you have just had ovarian surgery. Omega-3 fish oil, it's a great anti-inflammatory. It supports the hormonal environment as well as supporting the uterine lining. Did you know that low vitamin D has been associated with reduced fertility and an increased risk of miscarriages? After you've suffered an ectopic pregnancy, you cannot afford to go through anything traumatic, including a miscarriage after having had an ectopic pregnancy. So get your vitamin D levels checked. Many women are deficient in vitamin D, including in sunny climates. You should target a level of 75 to 150 nanomoles per liter. Now, regarding the teas specifically, there is red raspberry leaf tea. It's been traditionally used to tone the uterus. Some old school midwives recommend it in the second and third trimester in preparation for delivery. The evidence is limited, but it's considered safe in moderate amounts before a pregnancy. You must not use this in your first trimester, and you mustn't even use it in your second or third trimester without the advice and the guidance from your obstetrician or from your midwife. And this is true for any of the teas that I will mention in this video. Spearmint tea, there has been some links between, taking spearmint tea and lowering your androgen levels. Androgens are usually the male-dominated type of hormones, which are not ideal if you are trying to actively fall pregnant. You can't have high male or hormones because these will oppose pregnancy, and these androgen levels tend to be high in conditions like PCOS. But for ladies who have known high levels of androgen, for example, if they have PCOS, it is recommended you can have 2 cups of spearmint tea per day. Green tea is rich in antioxidants. 1 or 2 cups a day is just fine. Remember, it does contain caffeine, and if you're trying to fall pregnant or if you are pregnant, you must limit your caffeine intake to 200 grams of caffeine per day. What I want to caution you about is teas that are marketed as fertility teas or hormone balancing teas. These often contain multiple herbs at unspecified doses. What you must know is that some herbs are contraindicated, meaning you cannot have these herbs if you are trying to get pregnant, or even still if you are pregnant. So you might actually fall pregnant and not know that you're pregnant and take these teas, but the herbs that you are taking within these teas could be harming the baby that you don't know is already growing inside of your womb. Always check the ingredients before buying any blend, and you must inform your doctor if you are taking any of these teas. Exercise, the right kind. Exercise is one of the most underused fertility tools, particularly when it's done the right way and the right amount of times. I may not need to say this, but I feel like I should. After having an ectopic pregnancy, give your body time to rest and to recover before returning to exercise. Most women will need 4 to 6 weeks as a minimum after having had a salpingectomy. That's when the tube has been completely removed. Make sure you get clearance from the surgeon before returning to exercise. Once cleared, adopt the evidence-based approach. Moderate cardio, 150 minutes per week. That includes walking, swimming, cycling, dancing. Did you know that moderate intensity movements reduce reduces insulin resistance whilst improving insulin sensitivity. It also reduces chronic inflammation and supports hormonal balance. It will also promote healthy ovulation. Stretch training, do this 2 to 3 times a week. Resistance exercise improves insulin sensitivity and improves the body composition, and these both support ovarian function. Avoid any form of high intensity training, especially if you're doing this and your body weight is already low and you're not well. This pattern of training can actually suppress ovulation. So more is not necessarily better. Moderate, consistent movement is the goal. So the other thing that you should also have in mind is to monitor early pregnancy closely. After ectopic, your risk of having another ectopic pregnancy is generally going to be higher than the general population. Approximately 10 to 15% compared to 1 to 2%. Now, I'm not saying it will definitely happen again, but it does mean that the moment you get a positive test, you must contact your family clinician immediately. What your doctor should do is serial beta-HCG tests. This is a pregnancy hormone that helps us to know whether or not you're pregnant. So you'll do one test a day. The next test should be repeated after 48 hours. So there should be a minimum of 48 hours in between your beta-HCG test. In a healthy pregnancy, the beta-HCG approximately doubles after 48 to 72 hours. A slower rise in your beta-HCG warrants urgent investigations, particularly if you have suffered from an ectopic pregnancy before. For you who has suffered an ectopic pregnancy, having a positive pregnancy test would warrant, after we have been able to prove that there is a healthy rise in your beta-HCG, you will be in a category of women who will need to have a confirmatory ultrasound early. So whereas most women, I would advocate that they would wait until that they're 7 or 8 weeks pregnant before doing an ultrasound. For you, I would recommend that you will do one after 5 to 6 weeks, or even as soon as the beta-HCG is high enough. And I will leave that in the capable hands of your doctor to determine. And the reason for wanting to do an early scan is to make sure that this time the pregnancy is actually sited within the uterus. So the implantation has happened within the endometrium that is within the body of the uterus. Do not allow your doctor to let you wait for the 7 to 8 weeks before doing a dating scan. The moment you see a positive test is the moment that you should be seeing your family clinician. The main reason why is that early detection will give you the most options and the safest outcome. I want to address something that is not often spoken about when we address patients who have gone through an ectopic pregnancy. That's the aspect of fear. Trying to conceive after having suffered an ectopic pregnancy is not just a physical journey for a lot of women. It's also a very emotional and in some cases a spiritual journey. After having suffered an ectopic pregnancy, positive pregnancy test comes with a sense of dread alongside the obvious joy that they might feel. Every twinge will be analyzed. Every day you don't experience a symptom is terrifying. The anxiety can be also consuming. This is understandable. It's a rational response to a traumatic experience. I want to share the irrevocable, true, solid foundation, which is the word of God. In Isaiah chapter 41, verse 10, the word of the Lord reads, "Fear not, for I am with you. Be not dismayed, for I am your God. Yes, I will uphold you with my righteous right hand." Amen. That is a living word of God. Beyond all of these scientific evidence I have discussed, there is one truth that remains, and that is God telling you not to fear. Other scriptures that you might also want to read are Philippians 4 verses 6 to 7, Psalm 56 verse